is there's this immense amount of data showing a preventive, so it prevents transmission. And so we have a protocol where we prophylax patients, so high-risk patients and or those who just got exposed. So if you have a household member who falls ill, from numerous trials, if you put the household on ivermectin, very few actually contract the disease. So we have a protocol for prophylaxis, post-exposure prophylaxis for high-risk patients or healthcare workers, numerous trials showing that if you're on ivermectin, your chances of getting it actually approach zero. I mean, there's one trial from Argentina where they did 1,200 healthcare workers, 788 took ivermectin once a week, not one got sick. In the 400 that didn't take it, 58% got sick. So there's prophylactic data, and we have a protocol for that. There's also a whole other host of trials on early outpatient mild illness. Patients are getting better quickly. They're not going to the hospital. And so we have an early outpatient protocol there, which is daily, minimum of 2 days, maximum of 5, but stop when you feel better. Many patients are feeling better within 2 or 3 days, which means they need 2 or 3 doses. And then we have part of our Math Plus hospital protocol. We have a daily dose of ivermectin once a day for 5 days, and we're seeing remarkable recoveries. The patients are telling me, Doc, I took the pill in the morning, and by nighttime, my chest felt better, my fever went away, and the next day they feel better. I mean, it's truly a very, very potent medicine.
Yeah. So, Dr. Corey, she's saying that, certain groups were not included in the trials. You're saying that the trials are showing benefits. Is the answer then the recommendation to just use the drug for those who are actually in the trials? Would you both agree to that?
That's not how medicine works. So first of all, she's overstating who's not in the trials. There's many, many, many different trials done. They're not always excluding those that she said. There's no reason to exclude anyone with liver disease or kidney disease. It's one of the safest medicines known to man. That's why it's on the WHO's list of essential medicines. It's been given 3.7 billion times. It has an unparalleled safety profile. So to have concerns of whether you can give it to patients with comorbidities makes zero sense. We have more history and knowledge of this drug in treating disease in medicine than almost any other. 3.7 billion doses.